Hello and welcome to The Virus. I'm Jeremy Fernandez. The COVID pandemic is now believed to have caused the deaths of nearly 15 million people globally. The World Health Organization believes many countries undercounted the numbers of COVID deaths. The pandemic has impacted every single aspect of our lives for the past 2 years, but on the election campaign trail, it seems both major parties are afraid of talking about it for very different reasons. More on that in a moment, but first let's bring in Casey Briggs. Casey, how has the WHO arrived at that estimate of 15 million deaths?
It's a big number, Jeremy. If you add up all of the deaths that have been reported around the world right back to the beginning of the pandemic, you'll come to a number about 6.2 million. But we know, we've been discussing for a couple of years now, that that is really quite an underestimate because it doesn't include people who haven't had recorded on their death certificate that they died of COVID-19, and that does turn out to be a really significant number. The WHO's method here is relatively straightforward in principle at least. You look at the average number of deaths, the average mortality in a typical year, and compare that to the mortality that we actually saw over the last couple of years. Easy in practice, it's actually quite a difficult thing to estimate with imperfect data around the world, but that's the number that the WHO have come up with, 14.9 million deaths as a result of the pandemic, not just because they've died of COVID-19 necessarily, but because of all of the other impacts of this pandemic and all aspects of life. And by the way, that does not include the Omicron wave that we've just seen through the beginning of the year. Their estimates end as of the end of last year. And that's kind of in the ballpark of what we expected. Other publications and organisations have done estimates that have had similar or even bigger numbers, and some countries have had more excess deaths and mortality recorded than others. Some examples are Peru, Mexico and India. John Wakefield is one of the authors of the report from the WHO.
Healthcare systems were overwhelmed. And a lot of those deaths were in rural areas, and so many, the majority of those deaths weren't reported officially, and so that's why we see this huge difference. For India, there's a tenfold difference between the reported official number of deaths and then the excess deaths that we've estimated.
Australia doesn't have quite as many excess deaths. We think that the data has, we're pretty accurate in Australia, and really through 2020 and 2021, thanks to the approach of lockdowns and extra hygiene, we didn't see those excess deaths that we've seen in some of those other countries. We may well see a spike in excess mortality in 2022 though, because of the Omicron wave. And Jeremy, it is worth noting we are seeing deaths again creeping upwards. 37.1 a day is what we're seeing at the moment.
And this is interesting, Casey, because despite all this, it doesn't really seem that the pandemic's featuring as an election campaign issue.
No, not really a higher order issue that we're seeing on the campaign trail, and it's dripping away in terms of headlines as well. We're used to seeing COVID leading the news every day, and the numbers of stories about COVID, this is data from Stream, counting up digital TV and radio stories, have been steadily dropping just through this year, and increasingly the stories we're seeing now are more likely where COVID is incidental, and particularly in the context of the election, it's where, Anthony Albanese or another frontbencher gets COVID on the campaign trail. COVID's also not really the most salient issue on voters' minds either. All the surveys we've seen are putting things like economy, climate change, the cost of living, national security as really high order issues in terms of what's determining what will change their vote in this election, and COVID is not ranking anywhere near as high.
Casey, thank you. So what about you? Is COVID still a topic of conversation at home, socially or at work?
Who cares about it? Everybody, the majority are vaccinated.
Some of my friends have gotten it really recently, and then people go, oh, I didn't even know that was a thing anymore. But I guess that's not really true, kind of if you're looking at the actual numbers and statistics and everything.
This is obviously unscientific, but it is a sample of how voters are thinking about the government's performance during this pandemic so far, and whether that would change their vote. Janice and Peter, good to talk to you both. Thank you for talking to us. How do you think the government's performed over this pandemic so far?
I think it's all new to the world, and so I think they've done a fairly reasonable job.
We're standing here now. That's one good thing about it.
There are levels of action and inaction which will influence my vote.
I have family living in overseas as well. I think our government tried their best to look after their people.
He seemed all good in the beginning, and then he just dropped the ball, I thought. I work in St Vincent's Hospital, so I see how it's hard for everyone.
We didn't have enough vaccines. I know I was waiting for months. It turned out pretty well in the end, but I think when it came down to it, like, we were unprepared.
People are definitely tired of it, and if it's not in their face as much, they're kind of happy to kind of go on.
So why is COVID barely rating a mention on the election campaign trail? Sharon Friel is a Professor of Health Equity and the Director of the Menzies Centre for Health Governance at ANU. And Stephen Duckett is a health economist. He's also the former Secretary of what's now known as the Commonwealth Department of Health. Welcome to both of you. Professor Duckett, we're not hearing much from the major candidates on the campaign trail about COVID. Is it a reflection that people in the community have largely moved on?
I think there's a couple of factors at work. First of all, obviously the Liberals, the government, doesn't want to talk about COVID because it completely stuffed up the vaccine rollout over 2021, and so it wants to put all of that behind us. And I think Labor is in a somewhat different situation. Labor probably doesn't want to talk about it because if they raise it, they might be labelled as the party of lockdowns and taking away freedoms and so on. So they're wary about raising it as well. So even though, of course, lockdowns is not a dichotomy, you can have lots of other vaccine prevention measures. So I think both parties don't want to touch it, and that's, I think, one of the reasons why there's no mention of it in the campaign.
Professor Friel, what does it say to you that COVID sits relatively in the background in this campaign trail?
Yes, I think the parties are really trying to be on the front foot for moving forward, and of course COVID and all of the lockdowns and all of the terrible experience that has been COVID-19 just both creates a negative narrative and takes them backwards. And I think what we're hearing from the main parties is really about trying to be forward looking. But of course, the issues that were raised, the social fault lines that were raised during COVID-19, by COVID-19 still exist. And so by not talking about COVID-19 and by not addressing COVID-19, unfortunately, we're still not really having a policy discussion about those fundamental issues.
In this election campaign, a lot of the political rhetoric so far has come down to issues around the economy. So inflation, interest rates, national debt, household debt, the cost of living. In your mind, Professor Friel, how much is COVID a factor in these economic pressures?
So I think what COVID has shown really is hold up a mirror to the existing social inequities that we have in Australia before, during and exacerbated by COVID-19. And so whilst COVID has really put an awful lot of pressure on particularly socially disadvantaged groups, I think what it's telling is the absolute need for a policy response that addresses some of these underlying issues of income insecurity, of job insecurity, and housing affordability, for example, three big issues that really put pressure on the cost of living for households. So COVID and the economic impact from COVID-19 has absolutely exacerbated the pressures for such households in terms of cost of living and the ability to lead a decent life, many of which those issues were there beforehand, but it's certainly exacerbated it.
Well, Professor Duckett, is it the case then that, with these inequities that Professor Friel has pointed out, that some people do have the luxury of being able to move on, that working from home is a lot easier, there are, sort of maybe less income pressures, expense pressures, and so therefore people can afford to sort of park the issue for a moment during this campaign?
It's never been a question of what is the right public health thing to do and what is the right economic thing to do. It has always been the case that the right strategy in terms of public health was also the right strategy in terms of the economy. And what we saw was those countries which took COVID seriously were the ones that actually recovered and had less of an economic burden than those countries which didn't take COVID seriously. But certainly people like me who can work from home, can actually have their own study and so on, had a much better COVID life and can easily sort of talk about moving on much more easily than people who lost their jobs or who had to work in shared households with sharing access and all those sorts of things, or in precarious employment. And so, as Sharon is saying, we can see the inequitable impact of COVID, and certainly people in comfortable circumstances obviously want to be moving on, want to actually start their grey nomad existence again, want to actually travel and so on and so forth. But it's the ones who have lost their jobs and also who haven't actually been protected during the COVID pandemic, who might have long COVID, who are getting COVID again now, who are the ones that are suffering the brunt and who we don't hear about.
And so, Professor Duckett, what do you need to be hearing from the campaign trail to kind of look ahead to how those inequities might be addressed by the next government, which in its first 100 days is going to be encountering the peak of the flu season as well?
So I think there are two issues we have to talk about. First of all, the continuing impact of COVID on the health system. We are still seeing thousands of people admitted to hospital today. People getting COVID today. There are more cases of COVID this year than there were in 20 and 21 combined. And so the government has to actually, a new government has to actually say, we are going to treat the actual treatment issues, the hospital issues and so on seriously, and we're going to try and make sure the hospitals can cope. The staff are overwhelmed, they're exhausted, there's a huge backlog of elective procedures, there's a huge backlog of people who didn't go and see their GP because of a suspicious lump. So the government has to own the problem and do something about it. That's the first point. The second point is the government has to say, we need to learn from what actually went wrong and what went right during 2021 and 22 and say, this is something we're going to do differently. We're going to, for example, look at the equity impacts of the pandemic and actually design a system where that is always at the forefront. We're going to actually say about the flu season, we're going to make sure that everybody is vaccinated who's eligible against the flu. We're going to make sure there's not an income gradient in flu vaccination and so on. So we've got to actually think quite differently from how we thought during this pandemic.
Professor Friel, to what extent have those lessons been learned and how to look ahead to living with COVID, and also those relationships between federal and state governments? Because we've seen some state governments investing a lot of money into supporting the health system, but it's not necessarily taking place around the country. To what extent are we in a place where a government that comes in the next few weeks is going to be able to deal with some of those challenges in its first 100 days?
Yeah, well, I think really, as Stephen has laid out, there's a lovely plan of action that should be implemented. I think I also take a bit of hope from, we did see some really innovative policy making take place during COVID. Very quickly, action was taken in areas that for many years they were like, no, we just can't do anything about this. So one, it can be done if they want to do it. So it's making that political choice that they want to do it. I do think, though, we have such significant structural problems, both Jeremy, you're sort of pointing towards even this, the federated system that we have. Really, I think a very participatory and inclusionary approach to governance is needed. Can we not please have the same usual suspects around the table? Let's get, I think, a lesson from COVID tells us that to get the right sorts of policy responses that address what people are needing requires different voices around the table. And so be inclusive for those decision-making processes, an important lesson for governance. And I would also say we've got to invest in prevention.
Professor Sharon Friel, Professor Stephen Duckett, thank you both.
Thank you.
Pleasure. Thanks very much.
And if you've got a question you would like answered, go to the coronavirus section of the ABC News website, click on Ask Us Your Questions, and there you can submit your questions to our team and we'll tackle those in the next few weeks. That's the show for this week. Thanks for your company. Bye for now.